Hi, everybody. My name is Liz Serrier. I'm the Assistant Director for Engagement at the Institute for Health Metrics and Evaluation, and I'd like to extend a very warm welcome to each of you. Thank you again so much for joining us for this session, during which we will discuss the new publication policy, as well as GBD scientific writing. So today we have the honor of having Dr. Sam Ostroff with us, and he will cover the GBD scientific writing part of our presentation. And I am standing in for Megan Mooney, who's our Director for Engagement, and could not be with us this morning. And I will cover the scientific policy, the new publication policy part. So before we begin, I will tell you a little bit about Dr. Ostroff, who will give us the information that we need on the GBD scientific writing, and then we'll go over a little bit of housekeeping and then dive right into our presentation today. So Dr. Ostroff is a scientific writer at the Institute for Health Metrics and Evaluation, an affiliate faculty in the Henry M. Jackson School of International Studies at the University of Washington. With expertise in global health, scientific communication, and project management, he fosters dialogue emphasizing the role of data-driven insights in shaping health policy and outcomes. Sam and the scientific publications team at IHME are dedicated to disseminating information through compelling narratives that engage diverse stakeholders and advance public health discourse. Dr. Ostroff joined IHME in October 2019, initially supporting subnational estimation projects in Pakistan and Indonesia. With over 30 plus publications, he has since expanded his focus to additional GBD topics and regions and has delivered multiple trainings and workshops for the GBD Collaborator Network. Dr. Ostroff holds a joint PhD in South Asia Studies and History from the University of Pennsylvania, an MA in Middle Eastern, South Asian, and African Studies from Columbia University, and a BA from Bucknell University. So today's proceedings, just before the presentation begins, we will, as promised, review our agenda and some housekeeping. So we'll spend approximately 35 minutes reviewing the new publication policy and then spend the rest of the time exploring best practices for GBD scientific writing. Following the presentation, we'll have a 15-minute question and answer segment where each of you will have the opportunity to pose any questions that you might have. Out of necessity, the mics are muted, and so if you'd like to ask a question today, please do so using the Q&A function. And so let's dive right into why are we here today and what are we doing? So we are here, our objective is to familiarize, our collaborators, people who are interested in scientific writing using the GBD with our publication goals and policies. You will, of course, be aware that we've recently had some updates to the publication policy. So we'll present a little bit of the background and where we are regarding these, in addition to the best practices for writing GBD scientific papers and then sharing the resources that are available to you. And so GBD 2023 publication goals and policies. So why are we here? What's happening? Next slide. So we're here because we're all interested in improving life all over the world for our people. And we do that together with the GBD, which is the largest and the most comprehensive effort to date to diminish health loss across places and time. So health systems can be improved and disparities eliminated. So our basic underlying premise is that everyone all over the world deserves to live a long life in full health. And so with our collaboration, we make this possible. And our network, our joint group has grown exponentially over recent years. And with that has come, lots of responsibility as well. And so the new publication policy really arose out of a desire for us to safeguard the integrity of what we do, to ensure that what we do has impact over the globe, and that we do manage to have an impact on having everybody living a long life in full health. And so on our next slide, you will see the publication policy guides what we do to advance our vision. And so how does that happen? Through dissemination of knowledge and findings, which help to advance global understanding of health. And we do that through using the rigorous peer review process that I'm sure you're all already very familiar with. And with that, the recognition of adding new knowledge, adding new context, new dimensions to the fields, which in turn inspires, educates, and builds capacity across the globe for more scientific endeavors and also for applying that scientific evidence to programs, to policy. So again, underlying everything is our drive to inspire, to shape, to bring about positive change by sharing the evidence-based insights into improving health systems and reducing premature death and illness. And so we will, I think, all agree that in order to have, these effects, to advance our vision, to advance the goals that we share together about improving life, then there are certain the policies that we need to follow to make sure that we are keeping up our end of the bargain. And so in the next slide, we look at, what does the sharing of stories entail? And this slide just highlights a lot of the numbers. If you look, you see lots and lots of numbers that are pretty huge on what goes into producing the GBD. What that means in a nutshell is that there are many, many, many stories to tell. And telling those stories depends on certain factors, including one, our understanding of these numbers, our context across the globe, what is important to us, our area of specialty, what issues we face, whether we're in what part of the world we're in, and what's happening there. So I'll quickly just go over the numbers because I think they're super impressive and just highlights the many, many different angles, the many different stories that can be told using the GBD. So more than 555 billion estimates of diseases. Just take a minute, let that sink in. Billions. The data sources, over 318,000. And for 204 countries and 660 subnational locations. Our collaborator count now, more than 16,500 and rapidly growing. And those come from 167 of those 204 countries that we estimate for. The causes of death, 293, 375 diseases and injuries, 88 modifiable risk factors, and then for different age groups as well. So you can see from that there are many different configurations that you can just take from these numbers and tell these stories that mean something that can be interpreted by, non-academics, by people who are involved in implementing programs and shaping policy all across the globe. And so having a joint approach on how we tell these stories, on how we ensure that they are the highest quality stories, on how we ensure that we uphold the integrity of the science, but also still move hearts and hands to create the change that needs to be created, was really the impetus behind the new publication policy. And so on the next slide, we'll share a little bit of the considerations behind that new policy. And so quality, as I mentioned, just ensuring that what we produce is of the highest quality. And what that means is that so when policymakers, when government leaders, when community program activists see the GBD and information, it is clear that it is a high quality product that they can put their trust in, and they can be sure that the scientific evidence is reflected, the context is correct, and so actions can be taken based on those. Also, timeliness. The GBD is regularly updated. So rapid publication is critical. So what the process has done now is be streamlined so we can help collaborators to lead regional and national papers that they deem important to be written, that they can do so very efficiently, that they can do so in a timely manner and with a positive experience. Additionally, we looked at the large number of collaborators, 16,500 and growing. So coordination is critical. It is key to ensuring that our efforts, really reap the rewards that we want, that everybody has a good experience, that everybody is able to publish and reflect what matters to them, what is important in your neck of the woods, in your area. So to do all these things, to protect the integrity, to enable collaborators to publish more efficiently, more quickly, in a manner that really reflects their goals, their priorities, one of the things we've developed is the core catalog. And so what it represents is the collective plans to prevent duplication from within the network and also to diminish confusion with papers outside of the network. And I'll tell you a little bit more about the core catalog and the impetus behind all of this and how it's unfolding in the next slide and moving forward. And so, as you know, the GBD 2023 publication policy hinges on these three things that you see here. So global papers, those are written by invitation and a competitive request for proposal process. So the core catalog, those that are successful. You will remember that at the beginning, earlier this year, we did have nominations and invitations for authors for global papers from the network for these core catalogs. And then we also launched, sorry, a proposal process, a request for proposals, which was competitive from collaborators, and then announced the winners of those. Excuse me one second. So together, these two groups comprised the people who will, or the topics that will make up the core catalog, which are primarily global. In addition, we had national and regional specific papers, which collaborators can go ahead and write independently. What that means is more control over time, more control over the topics, and how these papers are turned out. Subnational papers, we did ask that there be some coordination with the GBD Secretariat, just because we have some subnational partners and want to make sure, again, that there's no duplication, that we spend our efforts in the most profitable manners for us all in turning out good papers quickly. And so next slide. What is the core catalog? So approximately 200 paper topics that covers, as we mentioned, the global trend in diseases, injuries, and risk factors. And again, as we said, so the lead authors we had selected through nominations, through invitation, and then through the open request for proposals. So I do want to highlight here that papers in the core catalog will be circulated for review by all collaborators with the relevant areas and expertise marked off in your profile. And so what that means is that is the opportunity for all of us, all in the network, to be able to contribute to these global papers in the core catalog, in addition to just having the opportunity to write your own regional or subnational papers. So what is the responsibility of us all going forward? So the lead author, if you're going to write a national, a regional, or a subnational paper, of course, draft a manuscript, create tables and figures, create the appendix, and we encourage you, of course, to use the resources available on the GBD Writing Center, which is new to support, the implementation of this policy and the work that we do together. So there you'll find, tips and information, access to other resources, guidance for writing the paper, essentially. And then you can always reach out to the GBD Secretariat if you have questions. In a departure from previous practice, now, collaborators, you do not need to register your paper or submit it to the GBD Secretariat for circulation to eligible collaborators if you're writing a national, regional, or subnational paper. So that is one other way in which we support, your efforts in trying to turn out timely and, scientific based papers. Next slide, please. So In the core catalog, the authors are responsible, in addition to everything I mentioned before, to collaborating with the relevant GBD research team to ensure, that we're on the same page, answering questions, methods, limitations, etc. And really just making sure that these are of the highest quality and do present the evidence in the best manner for uptake. We will also, because we'll be circulating this among the entire network, they'll submit their manuscript to the GBD Secretariat, so the lead author is responsible for that, reviewing any feedback that we receive from the rest of the network, and then revising the manuscript as needed. They're also responsible for managing the journal submission process, including addressing the peer review comments, and then they're also entitled to get support from the GBD Secretariat to circulate the paper, evaluate comments, collect author forms, prepare the author list. So those are the additional steps that need to be taken by all of the lead authors for papers in the core catalog, which are global papers. Next slide, please. So how do we qualify for authorship? So scientific component, of course, you know that the GBD follows the ICMJ criteria for authorship, which you can go onto the collaborator portal and get all the details there. So two ways primarily in which that happens. So it's the provision of critical and substantive review of a manuscript in your registered area of expertise. So this is primarily how most of the collaborators gain authorship in the papers that we put out. And then less commonly, just working directly with a research team on methods or on the paper, or also by sharing data explicitly for use in the paper. So these are the primary ways by which authorship is gained. And then the administrative component, 2 steps by the set deadline. So completing the authorship questionnaire that you will receive from the GBD Secretariat, and then completing and uploading the authorship forms as required by the journals. Next slide, please. So lastly, we want to, before I drop a note on the Writing Center, just to give some streamlining on the recommended timeline for GBD 2023 scientific papers. So we are, of course, in November, and so we should right now just be drafting the manuscripts and getting ready. By February, we expect that collaborators to review core catalog papers. So we expect to have them and send them around, get notes, feedback, and then get those reviewed. April submission to target journals. And then by May, we expect GBD 2025 core catalog requests for proposals to be open. We will share that date as we get closer to it. And then by that point in June 2026, capstone papers should be submitted, October GBD 2025 results. So what I want you to get from this is the plan, 1, for GBD 2025 right on the heels, and then 2, the timeline that we have with lots of journal interest still in GBD 2023 papers. So this is the timeline that we recommend. Of course, there's room for, things might change, things might happen in here, but that is what we recommend and how we anticipate things to move forward. Next slide, please. Okay. So having shared all of this, what the policy is, what the responsibilities are, what the timeline is, and just what the general expectations are, I'd like to just take a minute also before we hand over to show you the support that we presented, that is available to you in the collaborator portal in the GBD Writing Center. So there you can get, step-by-step guides, templates, the resource library, and also a video from the Lancet editor-in-chief, Dr. Horton, on what makes a successful scientific paper. So please, if you have not already, log into the portal, check out the Writing Center, lots and lots of resources available there. Next slide. One final note before I hand over to Dr. Ostroff is a note about downloading GBD 2023 data. So as you know, we've had the new security measures introduced on October 10th to safeguard our evidence, and the impact integrity of the GBD. And so to access the public GBD Compare and the results tool, you'll need to register and create an account. Importantly, this account you will create is very different from the collaborator portal login. So it's a whole different one. Please keep that in mind. The results tool, your download limit, 100,000 rows per user per GBD cycle. And then there are also some restrictions on email domains. Also pointing out if as a collaborator you need more data than the 100,000 rows, then you may request access to a collaborator version of the results tool, which uses your portal login and has a higher download limit. And there is a link by which you may submit your requests. We will share the slide deck as well in the collaborator portal, so you'll have the links there, as well as all the other information that we've shared. And so it's with great pleasure now that I hand you over to Dr. Ostroff, who will go into how we actually write the paper now that we've gone over the publication policy. Thank you so much.
Thank you very much, Liz. That was a wonderful overview of the new paper writing process. Really appreciate it. Good morning, everybody. Greetings from Seattle. Thank you for taking time out of your day to join us here today. I'm really excited for our time together. Today, I will be going over some best practices for writing a GBD paper. This is going to be rather high-level overview. I hope that it'll be really useful in your walk away with some really good tips and practices. Today we'll be covering a range of issues. Here's our agenda for today. I wanted to start with just outlining some objectives and outcomes, and then walk you through the paper writing process, how to choose a topic in a journal, and then offer some best practices for writing the methods, the results, the discussion, the introduction and abstract, and then go into some referencing. I'm going to hope that we can leave about 10 to 15 minutes at the end for questions and answers. So please, I think we can ask questions with the moderators. Today, what you should be able to walk away from this presentation with is the ability to develop each core section of the paper, the ability to conceptualize a narrative, be able to draft a strong scientific paper, learn how to select tables and figures that best represent the results and support your central narrative, and also enhance our capacity for how to understand, interpret, write about GBD results. My goal for this is for you to become what I would call a database storyteller, to become really effective scientific communicators. And you'll hear me talk about how to conceptualize and draft a narrative throughout this presentation. So let's get started. First thing to do is to get organized. You need to select a topic. Topic selection should be considered the criteria that's been previously described by Liz. Consider your and your team's area of expertise. Think about the global scope and scale of your paper. Is this going to be global, regional, or country-specific paper? Ask yourself, can you bring an important perspective or a new voice to the topic or the subject area? Next, you'll need to identify a journal. Based on your topic, you can narrow down your list of target journals. This could be, a more general medical or scientific journal, such as The Lancet or Nature, or have a regional focus or be topic specific. At this stage, in the early drafting of your paper, through the initial submission, I suggest that you choose one target journal or family journal. There's so many different style guidelines and requirements for each journal, different citation methods, etc. Really, it's really important just to kind of stick to one, so that it'll create a smoother drafting process. Next, you'll want to start writing an outline. The outline should be specific, to your target journal because journals have different required sections, styles, and guidelines. Consult the journal webpage for specific guidelines and requirements based on your outline. Um, and journals will also provide various resources for authors that I encourage you to consult. Consider reviewing a recently published paper in the journal for reference just to see how papers are organized and structured and what a published paper looks like in the end. Um, and this is as you're starting to draft your outline, you want to keep in mind your narrative. Building a narrative, um, you can build a narrative at this stage using topic sentences for each paragraph of the intro and discussion, and then using descriptive headings for the methods and results. The narrative is essentially the story that your data is revealing. What are you trying to say? A strong scientific paper has a easily identifiable and easily narrative that's easy to follow. Don't really approach the blank space in the page as just a dumping ground for a whole bunch of results and a summary of the methods. It's taking these evidence, the scientific evidence and estimates from GPD 2023 to develop a compelling narrative. We on the scientific publications team at IHME suggest writing a GBD paper in a different order than how it is arranged for publication. On the left, you'll see how a conventional scientific paper might be organized in its published form. However, on the right, you'll see a recommendation for how to order the paper writing process. You can see that they look very different. The idea here is that you start with the methods, figures and tables, and results. Doing this, we recommend that you do this because with each GBD cycle, these are, for all intents and purposes, fixed and established in the capstone papers. So you can consult other GBD publications, IHME resources such as the Writing Center, and this also forms the core of your paper before you're moving into the analysis and interpretation. Um, you know, what I think this demonstrates is that writing a high quality, compelling scientific paper is not a linear process. You don't really start with the first word and end with the last word. Um, it helps to be a little bit more strategic. So following this writing order, we found to be a really effective approach. So let's turn to the specific subsections of a scientific paper, and we'll start with the methods. What are the methods? The methods section of a research paper details how the research was conducted, and it outlines the procedures, the data sources, the analytical or modeling techniques that were used to answer the research question. What to include in the methods? You need to include each metric and modeling analysis here, and you need to summarize and cite the existing materials on the methods that were used in the paper. So, what does that look like in practice? Each metric used in the study must be described in the methods section. For example, if your results include YLLs and YLDs, you need to make sure to define and describe how those were calculated here. If you're presenting estimates by SDI, you need to present a definition for SDI and tell the reader how SDI was calculated. Each modeling analysis in the study must also be described. These are the major steps in the estimation process that were used for each metric and estimates that's presented in the paper. One thing that I would like to emphasize is that you are not writing the methods section de novo, that is from scratch. What you're doing, the approach here, is that you're collecting, collating, curating already existing material from GBD resources and publications. You can bring your own subject matter expertise and technical knowledge to this as well. But your task here is really to summarize and cite GBD methods that are relevant to your topic. And the methods here should also be specific to the scope of your paper. the results that you're presenting and the locations and geographies of the paper. So if you're not presenting estimates by SDI, or you're not presenting estimates by, um, you know, another metric, then those don't necessarily need to be described here in the paper. Um, this is one possible way to structure a method section. This is just a suggestion. It's not a requirement. Um, but this is a good kind of outline or template that you can use to draft the method section. Going from first paragraph, you can provide sort of a summary or an overview of the methods, and then move into more specific descriptions, geographic units, age groups or time periods, GBD, disease and injury risk factor hierarchies, data sources and processing, modeling analyses, and then finally the presentation of the estimates. By presentation of the estimates is like how are we reporting or sharing uh, the estimates in the paper. That leads us to the next section, the results. Uh, the results section of the paper is where the main findings, the evidence, the science of the study are being presented. So what are some effective ways to communicate the results? Um, the best papers describe the results in an order and logical fashion. To achieve this, you want to simply avoid writing out a string of results without thinking first about which ones best support the overarching narrative of your paper. To put it another way, do not turn numbers into words, but turn data into stories. And you can achieve this by presenting the most important results or major trends found in your figures and tables sequentially. So you don't need to be comprehensive. You're not presenting every result. You're not presenting every estimate. That's what the online visualization tools are for. What you're doing is you're pulling out the key findings, the major trends, um, and presenting those in the tables and figures, and um, um, presenting those in the tables and figures, and making it easy for the reader to move from the written main text and to the tables and figures. Um, and this really forms the backbone of your paper because it's presenting the main findings of your paper, and you're starting to present to the reader what the data is revealing. Most important results should be presented in your figures and tables and then described or referenced sequentially in the results section. All results in the main text need to be found in a figure, a table, an appendix, or an online tool. Um, not doing so, not presenting not presenting any numbers that the reader can find in figure, table, appendix, or the online tool, it's a major red flag for editors and reviewers. So just keep that in mind. Um, for your target journal, you'll want to check the technical requirements for tables and figures, file formats, etc. Um, generally, we suggest that you aim to include about 5 to 6 total figures and tables with the main text, and then anything else can go into the appendix. Each table and figure in the main text needs to be referenced and included sequentially. So what does that mean? That means, you don't want to start a paragraph where you describe table 2 before you uh, describe the results in table 1. So you want to move through it logically and sequentially. A simple way to structure and organize the results section is for it to parallel the methods section. So this will not only make it smoother for you, the author, to organize your thoughts, but it'll also make it easier on the reader. So for example, as you see here, in the methods, you describe incidence, mortality, and then DALYs. That can be mirrored in the results section where you're presenting or reporting estimates by incidence, mortality, DALYs. You can also present the results in what I would call a nested or cascading structure. So as you can see, this follows a very logical and intuitive pattern. So for example, in the results section, you could present estimates at the global, regional, national, and then the subnational level. Within those categories, incidence, death, DALYs. Within those categories, you're looking at counts to age standardized rates. Within those, you could be looking at changes over time. So the last period of study, GBD 2023, and then looking at changes over time. And within that, you could be looking at moving from all ages to age-specific groups to sex-specific groups. Not all of these categories will be included in your paper. This is really just um, a way to think about how to organize your results section to facilitate the writing process, ensure consistency, and to make it easy for the reader to follow. The results section should also include a description of the GBD hierarchy. You need to include this so that the reader can understand at which levels you are comparing causes or risk factors. You don't want to compare causes or risk factors at different levels um, of the GBD hierarchy. And giving a short description of GBD hierarchy levels in the method section and then in the results will allow you to do this pretty quickly. So for example, you can say in the results section, cardiovascular diseases were the leading level 2 cause of death globally in 2023. Um, and so it kind of gives the reader a sense of what causes and risk factors you're comparing and making sure that they're being compared at the same level. Here's a list of tips, some do's and don'ts when drafting the results section. I think the most important ones on this list include, uh, you know, not do, do not give counts for populations that are different in size. Pay attention to overlapping uncertainty intervals and uncertainty intervals that include or cross zero. Um, Make sure to observe GBD rounding standards, and please pay attention and differentiate between counts and rates. These are some just kind of recurring issues that we see in a lot of GBD papers, and they kind of become red flags for editors and reviewers and journals. Let's turn to the discussion section. The discussion section is a section of a paper that provides an interpretation of the study's findings, explains their meaning, and relates them to existing literature and theory. The discussion is an important section for ensuring that your paper has a really strong narrative. And here's where in the paper where you can really here in the discussion is really where you can let the paper breathe. We don't want to give the reader tons of results and then just rehash them in the discussion or forget them altogether. We really want to discuss the importance and patterns and trends that emerge out of our analysis. Um, Here are some examples of some strong narratives that you might find in a GBD paper. Really want to think about the most essential part of the story that your data is revealing. What story are you trying to tell? Um, Here's some tips for how to write a strong discussion section. Um, what you want to do is highlight key findings and provide potential interpretations or linkages to maybe current programs or initiatives or policy implications. One thing you want to keep in mind is you don't want to go beyond the scope of your study and the discussion section. It needs to be kind of aligned with and tied to the estimates that you're presenting. Another thing to keep in mind is, don't want to describe specific policy solutions that are not well evaluated, or not specific to the context, location, or population of your study. Um, Here's one suggested way that you could structure your discussion. but again, check the specific guidelines for your target journal. But generally, some combination of these sections will likely be part of your paper if you're targeting a journal, whether it's the Lancet family or somewhere else. The discussion should be about 4 to 6 paragraphs. It'll include a summary of results or like an overview paragraph, and then you'll move into supporting paragraphs that might include additional further interpretation of the results, future directions for research or policy, and then you'll also need to include a limitation section and a conclusion. Um, So recall at the beginning of this presentation where when I noted that the order of writing a paper is different from how it's structured and organized in its published form. So we've gone from the methods to the results to the discussion, and now we're back to the beginning with the introduction. What the introduction does is it introduces the topic, it provides relevant contextual and background information, states the research question or thesis statement, and overall just kind of like frames the topic for the reader. The introduction should provide a roadmap for the paper, provide the relevant background and context of the existing literature and data. What do we already know? Who is providing that knowledge? The introduction can also identify any gaps or controversies in the literature or data, and maybe even, pitch your solution. The Generally with GBD papers, the problem is a gap in reliable, up-to-date, comparable, geographically complete estimates. And the solution is, better estimates such as GBD. In the introduction, each paragraph should have a strong topic and concluding sentence. A good way to structure the introduction is paragraph one, describe and highlight the significance of your topic. Paragraph two, describe what previous studies have done or if there are any major initiatives or programs or events or controversies. And in paragraph three, describe what this specific study does. Describe your topic in a broad context and state why this study is needed to fill current gaps in knowledge, address controversies, or solve an urgent problem. The abstract is a summary of the entire study that provides a brief overview of the research question, methods, key findings, and conclusions. Again, each journal might have slightly different requirements, so check the style guidelines and requirements for your target journal, but generally the abstract is going to include these 5 things: background, methods, findings, interpretation, and sometimes a funding statement. Um, what you see is that the abstract essentially mirrors other section, the main text of your paper. And these are really tight, succinct summaries or overviews of the section. And for better or worse, this is often the first or sometimes even the only part of a paper that people will read. And so you should strive to communicate in succinctly and effectively the main insights and top level findings of your paper. Um, Lastly, I'll cover this section kind of briefly because we often receive a lot of questions about referencing and citations, and I don't want to overlook it. Um, One thing that I will say is that I want to encourage you to treat referencing not as an afterthought or a little annoyance. It is an important part of your paper because it situates your work in broader scientific discourse, tells the reader about the conversations and debates that you're participating in, and it also serves as an important reference guide for your audience. Here are a few best practices for referencing. We like to use Zotero as our citation software. I would encourage you to do the same. It's pretty user friendly. It's easy to use. It's also free. Um, if you're sharing, and it's pretty widely used. So, encourage you to download and use Zotero. Um, Follow formatting standards that are specific to your target journal. The different journals have different citation guidelines. For example, the Lancet uses Vancouver style. Um, Other journals you would use might use other ones. Um, as you're going through and referencing and citations, think about what papers might be the greatest use to the reader. Um, think about whether you're fully crediting the authors of the ideas and findings presented in the paper. And again, set aside time to add references. Don't think of it as the last thing you do or a little annoyance or an afterthought. Um, Set aside time to do this. Um, Want to be responsible. Think about the politics of representation here. Who's represented in your citations and who's not being represented in your citations. Um, Read the papers. Remember to read the sources that you're citing so that you know the content of the papers and that these are the best papers to reference to substantiate your work. And look beyond citation counts and impact factor. Make sure that the paper is first and foremost relevant to your work. Lastly, I wanted to just include a list of links and resources. Liz had already previously referred to the newly launched GPT Writing Center. This is a wonderful interactive multimedia resource with a just host of this just wonderful material that I encourage you and your authoring teams to consult and explore. Other links here is the link to the GPT 2023 core catalog, our new publication policy, um, and the GBD capstone papers, which were just published in the Lancet, um, and the GHDX. So we have about a little over 10 minutes for Q&A. I thank everybody for your time. I hope this has been useful. And please do not hesitate to reach out to us with any questions or concerns.
Thank you so much, Sam. That was excellent and very clear. We do have some questions already from our audience, and so we'll dive right into them. One question, and this ties in, I think, directly to one of the slides that you had in the presentation, is how does understanding and correctly applying the global burden of disease hierarchy levels improve the accuracy and comparability of results when analyzing causes or risk factors, and what problems might arise if comparisons are made across different hierarchy levels? So I think in maybe slide 33, I believe, and back there, there was, some of the GBD hierarchy. But Sam, I don't know if you want to say anything to this, but I will say that one of the biggest goals of the GBD is comparability, to make sure that we can compare like to like. And so the hierarchy, really groups these causes, risk factors, etc., differently. And so we'd like to make sure that we're comparing, apples to apples and not comparing, a bucket of apples to a barrel of oranges. And so the hierarchies go down from largest to more specific. And so when you're comparing, you want to make sure that you're comparing, the large group to the next one, and not a subgroup of one to another one, is, basic point that I'll put. But I'll hand it over to Sam to add any information to that.
Yeah, no, that's a good point, Liz. It is that mutually comprehensive and mutually, yeah, that is baked into the GBD enterprise. If you think about it from just like a scientific accuracy standpoint, um, you know, it doesn't make sense to say there were X number of DALYs for non-communicable diseases and Y DALYs for, um, you know, ischemic heart disease. Those are different levels, and you're not comparing, um, yeah, you're not comparing comparable categories. The other thing that I will say about that is that it's also just it reflects a careful attention to detail and a privileging of accuracy, which reflects well as your paper moves through the peer review process, um, and doesn't get flagged. Something like that wouldn't get flagged by editors or reviewers. And so it just strengthens and improves the overall quality and presentation of the paper when you're paying attention to that level of detail.
Exactly. Great. Thank you so much, Sam. And also, one of our audience members has supported this with, yeah, readers like to understand whether the results refer to broad disease groups or specific causes. So prevent confusion, misleading comparisons. So that is absolutely the goal, that we make sure that what we convey is factual, scientific evidence, and also very clear and useful to our readers.
Yeah, and just the last thing that I would say on that, the slide that I presented on that, um, you know, how to structure and present your results section, that nested or cascading structure, you can kind of move from, you know, general higher level est estimates to more specific. So just kind of keep that kind of logic and flow in mind when you're um, drafting your results section.
Mhm. Okay, thank you so much. Another question that we have, Sam, is in the GBD study, is it insightful to compare estimates for country levels with the five SDI quintiles? And is such a comparison meaningful?
Um, that is a good question. Um, you know, one thing to bear in mind is that SDI, right? SDI is a composite index. It's not a country specific thing. And so comparing SDI quintiles to countries, um, I think is, again, going back to the making sure that we're comparing things accurately. And so, anyways, comparing, I would discourage you from comparing country specific to SDI quintiles because the country specific estimates are kind of one category, and then SDI is a separate category, and they're not comparable in that way. Does that make sense?
Absolutely.
Yeah. Okay.
Thank you.
Because one is a composite based on various criteria, and then the other is specific to a country.
Right.
Yeah.
Okay, so we have a few minutes left and we have questions coming in. So I will go to another one really quickly from Danielle, who asks, or who says, as members of the Global Collaborator Network, how can we fight against the surplus of low quality global or regional papers that use the GBD estimates without a full understanding of the overall process and just limit to download the results? Many of these papers seem to be produced in paper mills and are saturating several journals. Well, Danielle, thank you so much for this question. I'm just going to jump in here and say you hit the nail on the head for, part of the reason behind our publication policy this year and the other measures, security measures that we've had to put in place to safeguard not just the data, but also the integrity of what we do to make sure that what we produce is actually evidence-based, that it is high quality, and that we protect the good name of the GBD and the good work that we can do together. And so, from our engagement point of view, what I would say how you can help is just really be involved and be engaged in the process, of the publication, recognize that the resources that we provide, say the Writing Center, we've had a series of webinars, this webinar really, to promote exactly how those can be used. So just being engaged and also being a good contributor. So if you see things that, are not reflective of the high quality work that we would like to produce with everybody, that we would like to have out there representing the GBD, that, let us know. And also, just if you even have suggestions, ideas, or know how we can further advance, our publication policy, the process for protecting, the integrity and our work together. Absolutely. But I guess I just want to underscore that all of this is actually in an effort to make sure that we protect, the thing that we all love as academics, the scientific evidence, how we put it out there, how it gets used, and really the heart of what we're trying to do together. So I think it's just a joint endeavor with us all to make sure that we keep working together to do so. And Sam, I'll hand it over in case you have anything else that you want to add to that. But I really appreciate that question.
Yeah, that's an excellent question. And I think, um, you know, Liz, you made a really good point about the, the significance and the value of, um, you know, and our commitment to producing high quality papers. Um, and, you know, investing our time, building our skills, improving, increasing our capacity to analyze and interpret and to craft really strong, compelling scientific papers is in the best interest of of all of us and you know scientific enterprises in general. So um,
Yeah.
yeah,
Yeah, absolutely. Related to that, we have another question about will the number of authors for the core catalog increase for the next GBD cycle? And so the plan is, yes, we anticipate that to increase because we anticipate some more contribution for high quality papers exactly in line with this from our collaborators. And that if you have attended this session, others, etc., that we will be in a position to have more high quality global papers written by more members of the collaborator network, which is what we're working towards. So we will also, of course, repeat the request for proposals so that we can um, make everybody have the opportunity for many of us to get involved in the process while we also still, protect our product and safeguard the integrity, reputation, and therefore the usability of what we produce. Um, okay, and I think we have 2 minutes left. So if you have any additional questions, now's the time to put them in the Q&A to grab the chance to get them answered by us. And then as we wait for that, I will also just address another couple questions that we had in the chat asking about the availability of WHO regions in the tools. So we expect those to be added back in early December. So there will be the updates with these regions added in. Uh, Ahmed says, how can we collaborate on publications? I already have over 50 CI publications. So collaboration and publications, as we indicated with the global papers, we will circulate all of those in the core catalog to the network, depending on and so you're able to contribute in the two areas that we identified either by making, substantive comments, data sharing, etc. So these are ways right now that you can contribute to the core catalog of global papers in publications. And then moving forward, of course, if you have a group that you would like to work with on regional, national papers or even subnational ones, reach out and we will provide some guidance on doing that. Um, Also, I don't see the WHO region of the Americas, which includes the WHO regions. All of these will be added back into the tools in early December. So keep an eye out and you will see the WHO region of the Americas in there again. How are we safeguarding integrity and credibility with rising AI? Well, that's $1 million question there, Zaidan. I do think that, that is definitely an issue that we have to deal with in all areas of our, rapidly changing life experience right now. But the steps towards just having a closer one relationship to the authors that are part of the core catalog, to what we put out, protecting the access to the data as well. You will see the restrictions that are put on. All of these are in an effort, one, to creating a more informed, more tightly knit community so that there's more, a little bit more control over what we put out together, and therefore the identification of what we can vouch for, what we cannot. But of course, as you can imagine, it's ongoing with the, rising challenge of AI that we all are dealing with. And Sam, I don't know if you want to add anything to that.
Yeah, with a little bit of time left that we had, and this isn't something that I included in our slides, but I'm glad that it's come up in the Q&A. Um, uh, the AI using AI and large language models can be quite useful when writing, but this is a caveat. Um, I think it should be used in a very limited sense, in very limited ways to just kind of improve, polish, edit a little bit. Um, but beyond that, I think that we should be very cautious about our use of AI tools when writing scientific papers for a host of reasons. Specifically to GBD, much of the results, one thing that I would strongly discourage you from is taking GPT results and running them through any publicly available AI tools. I mean, one is that, you know, a lot of the data and other, um, some of that stuff is proprietary. Some of that stuff should not be going out into the public domain and being used to train AI models. Um, you know, you do not want to rely on AI or LLMs to interpret or analyze or produce estimates by any means. Um, and, um, you know, again, I think it can be quite useful just for polish and editing, but beyond that, I would strongly discourage, using AI to conduct any sort of original analysis or interpretation. Um, so,
Okay, thank you for uh, highlighting that, Dr. Ostroff. And I think with that, we have overshot our time. So we've taken a little bit more of your time today than we planned to. So apologies for that, but it's been great having you with us. I do believe that, together we can really make the GBD, something that maintains, the trust that it has, the high quality, and really can be used to improve, health and lives of people all over the globe. So thank you again for working with us through this time of change, for going through the publication policy, for the scientific writing process using the GBD. And we hope to see you again very soon at another webinar or, in another forum with us as we together strengthen and protect and use scientific evidence to improve life around the globe. Thank you all so much. Have a great rest of the day wherever you are. I will say again,